Okay, so Dwayne,
Yes.
one of the questions that I'm getting a lot from cancer patients, not only patients who are currently on treatment but have had cancer, is there's a concern or fear about receiving the COVID vaccine. And
Okay.
so I was happy, so happy to hear that you decided. But tell me about your process and how you got to that point of saying yes,
With the vaccine,
yes.
well, I had already had it once, and I'm lucky that I had a very mild case. Um, I guess for me, people are dying, and this virus is spreading. We've got this huge pandemic, and I thought, they say it's 95% safe. They've tested it. I know they kind of rushed to get it out. A lot of people are saying I'm going to wait and see what happens, but for me, just this living in fear, the isolation, the masking. Of course, I'm still going to do those things, but it was just the fear um, was so overwhelming for me, and I just didn't want to live in fear anymore. And I weighed the, taking the vaccine against getting COVID, and taking the vaccine won for me. I just felt that the risk of taking the vaccine was far less than the risk of catching COVID. And this is my second pandemic. I lived through the AIDS pandemic, and I remember the various medications and um, treatments that came out. When I tested positive, the only thing that was out was AZT and DDI, and they were very toxic medications. I remember taking them. I remember I had a Rolodex. Maybe some of your viewers are too young to remember Rolodex. I had a Rolodex that was full of my friends'
Excuse
names.
me.
Some of your viewers, not you, some of the
Oh,
viewers. I had a Rolodex that was full of my friends' names, and as they started to die, I would just pull their cards out, and eventually it was a very thin selection of people in the Rolodex. And I just said, I don't want to go through that again. Um, I'm going to do what I can do to survive this thing as quickly as I can do it. So hopefully I've made the right decision. I feel confident in it, and that I have. I just maybe just the belief that it'll work will have a placebo effect and help keep me safe.
when did you have it?
Friday. So 2 days
Okay,
ago.
so have you had any side effects?
The area where the injection was is sore. I've had the same reactions as a flu shot.
Mhm.
So the first day I had a little fever, some lethargy. I was tired, a mild headache. The next day,
Lethargy. What's lethargy?
lethargy is tiredness, isn't it?
Felt tired.
Am I correct? Yeah. Um,
Very medical term there.
oh, is it? Okay. Sorry. Sorry to be so medical. I'm not a doctor. I just play one on TV. Um, the site was very sore. Got it in this arm, and it's sore. Like the next day, I could barely lift my arm. And then now it still hurts a lot. So it's really swollen. It hurts a lot more than the flu shot did. But still, they give you a sheet. They tell you all the things to look out for. They say it should clear up in 2 to 3 days. It's very interesting. A neighbor of mine, an elderly gentleman, got one maybe 2 days before I got one. And yesterday, his brother called me to say that his nurse was there and he couldn't reach his brother. The phone was ringing busy and he was probably off the hook, whatever. So I went to knock on his door and he was yelling, saying he couldn't move, he couldn't walk. So we had to call the paramedics, and his brother came in and he was yelling, "Oh, it was that COVID vaccine. I knew he shouldn't have gotten it." And it was just blame it all on the vaccine. And I got a little scared, and turned out that this gentleman's blood sugar, he's a diabetic, and his blood sugar, I think he said that it should be between 100 and 120. His blood sugar was 680.
Wow.
Wow, that's such a wonderful, wonderful example, because we're hearing people talk about these horrible side effects from the vaccine, or even during the research trials, there were things like that happened and
Mhm.
people were blaming it on the vaccine. But the truth is, if you get a population of people, they will have issues that
Right.
come up. So I'm so glad you shared that example.
Right. So we just can't be rushed. You can't rush and blame everything on the vaccine if you have underlying health issues, especially if you aren't doing what you're supposed to do.